We have the same learning outcomes, but this time we'll focus on trypanosomiasis, Chagas disease, and some other antiprotozoal medications. So for trypanosomiasis, why you always sleeping? Because it's related to the African sleeping disease. Okay, it's a human African sleeping sickness. It's a vector-borne parasitic disease caused by the Cheche fly from the Glossina genus. So this is just a review. You should have studied this already in another lecture. Gradual progression, but then it can lead to coma. There are two forms, the Western and the Eastern. The Western one is caused by Trypanosoma brucei gambiense. The Eastern one is caused by Trypanosoma brucei rhodiensiense. Okay? Ah, rhodesiense. So, both have similar vectors. The primary reservoir for the West African hat is yung humans. Sa East, primary reservoir would be antelopes and cattle. So West African hat is chronic, while East is acute, less than 9 months. In West African hat, there's late CNS involvement, even if it's chronic. In East African hat, there's early CNS involvement. In PE, how will you be able to distinguish the two? Would be yung presence of lymphadenopathy. Mas prominent sa West African hat. And epidemiology, rural populations, West and Central Africa. That's why it's West African, human African trypanosomiasis. Over 98% of the cases. And yung East, it's actually less common. And it's found in the wild parks of Eastern and Southern Africa. So, if ever you go to Africa and work there, like to be part of mga groups, like Doctors to Africa or Doctors Without Borders, you might need to restudy this. Okay? So, this is a table that summarizes the the treatment. We'll be talking about 4 drugs here. For Western hat, okay, so Western muna tayo. Early, you use pentamidine. If there's CNS involvement already, you give eflornithine. For early East African hat, suramine. Okay? Pag may CNS involvement na, melarsoprol. So pentamidine and suramine, as mentioned here, are not used for late stages. Suramine can also be used for West African and eflornithine can also be given for early stages, but they are just alternatives. And pentamidine can also be given for East. The Fortimox, we'll talk about that later, but you can combine it with the eflornithine for late CNS involvement, for late West African hat. Okay, so let's discuss the 4 drugs that we talked about. For the first one, suramine sodium, it's a complex derivative of urea with antiprotozoal activity less than pentamidine. The DOC, early hemolymphatic East African trypanosomiasis. So, it works fast. It's a DOC. For the MOA, it inhibits the trypanosomal enzymes. Okay, very general. Pharmacokinetics, it's given via IV because it has extensive protein binding also. Enters extracellular space but does not cross the blood-brain barrier. Hence, it's not given for those with CNS involvement. Does not cross. Tapos DOC for early East. Okay? Later, I have a mnemonic for everything. Adverse effects, 90% urticarial rash. But you can have severe diarrhea, tiredness, malaise, polyuria, increased thirst, clouding of the urine. Less common would be heavy proteinuria. Can also lead to adenocortical damage, decreased cortisol and aldosterone. Suramin sodium, this is the dose. Okay, just nice to know. Or if you will go to Africa and actually work there, then you have to go back to this lecture. Eflornithine is the second drug. It's a hair growth agent. It's applied topically. It's derived from ornithine, and it's for West hat, advanced West hat. Okay? It's specific for Gambiense. But it's an alternative for early West hat. Okay? Not effective against Rhodiense due to the resistance. That's why it's not the drug of choice for East hat. MOA inhibits ornithine decarboxylase, involved in polyamine synthesis in trypanosomes. Okay, so this is the dose. It's given via IV as well. And it readily crosses the blood-brain barrier. Hence, it's given for those with CNS involvement. Adverse effects, anemia, leukopenia, thrombocytopenia. So blood dyscrasias, convulsions, and impaired hearing. But it's less toxic than melarsoprol. Less common would be the common drug reactions. The third one is melarsoprol. It should be limited only for severe advanced trypanosomiasis. Okay? It's extremely toxic and deadly. So you have to justify giving it. It's first line for CNS East hat. Because it's the one that's acute, diba? And actually more severe. Second line for advanced West hat. Okay. It's an organic arsenical compound. So it's a poison. It inhibits a large number of enzymes in the trypanosomes. And Pharmacokinetics, it's given via IV again. And you don't give it via oral administration because it's poorly absorbed in the gut. And it has good entry to the CNS. So eflornithine and melarsoprol have good CNS entry. Excretion is via the urine and feces. Ang most serious adverse effect niya ay reactive encephalopathy. Causing all of these neurologic symptoms. Okay? And these are probably due to the disruption of the trypanosomes in the CNS. Frequent, less severe effects would be myocardial damage, albuminuria, and hypertension, agranulocytosis, and others. Okay, so how do you remember? We discussed pentamidine already, di ba, sa spam. So the three, yung suramine, eflornithine, and melarsoprol. Remember, di ba, pentamidine, penta, 5, DNA, RNA, phospholipid, protein, synthesis. 5 words. So, notes, don't focus on the image yet. I'll explain it later. That's my mnemonic for that. So, it's for early West hat. Suramine is for East. Eflornithine is for West. Melarsoprol is for East. Okay? So, how do you remember? Di ba West si Gambit? So, nandito siya sa western part of Africa. So, this is actually the map of Africa. I placed him near the center and west. Kasi dito yung West African hat, di ba? Human African trypanosomiasis. Yung East, nandito. Bakit Gambit yung picture dyan? For those who don't know, his name is Gambit. He's a Marvel superhero. Part of the X-Men, okay? Early, pentamidine. Late, eflornithine. Okay? Those are the drugs of choice. Remember, kasi Gambit is very maliksi. He's very active. So, his favorite subject is PE. So, Gambit, which stands for Gambiense, lives in, found in Central and West Africa. Okay? Favorite subject, PE. In that order. And then si Rhoda is a cow. Because Rhoda is Rhodiense is found in cattle and cow. And the drugs of choice for East, and it's also found in the South area, would be suramine and melarsoprol. So Rhoda shops at SM. Rhoda the cow shops at SM. Gambit loves PE. Alright? Gambit from the west, Rhoda from the east. The next disease that we'll be talking about is Chagas disease. Very simple because you only have one drug. It's also known as the American trypanosomiasis, potentially life-threatening, and it's caused by Trypanosoma cruzi. Okay, so you have a cruise in America, in northern South America. Okay, tapos pupunta ka ng Central America and then you'll go to Mexico. That's how you remember it. Trypanosoma cruzi. You take a cruise sa South America. Okay, it's a vector-borne disease that's transmitted by the kissing or assassin bugs or the triatomine bugs. It looks like that. And they emerge at night to bite and suck blood. Okay, the feces of the insect contain parasites which can enter the wound left after the bloody meal. Others, via blood transfusion or infected from the mother to the fetus. So you can have the swollen eyelid, which is the famous Romana sign for the American sleeping sickness. Within a few days, fever and swollen lymph nodes may develop. More commonly, patients enter an asymptomatic phase, and then which can last for months to years, and then they develop the Romana sign and can cause damage to the heart, intestines, and esophagus. So what do you say when you have a classmate who is matyaga? Diba? When you want to praise someone, Nox! Nox naman! Nox! Okay, bakit Nox? Okay, it's related to the drug. Nifortimox. Okay? If you're matyaga, Chagas disease, you deserve a compliment. Nox! Okay? So this is the DOC for Chagas disease. It's a synthetic nitrofuran ring. It increases oxidative stress by producing free radicals. Okay? And then pharmacokinetics does not cross the BBB. Kasi hindi naman affected masyado ang brain, so it doesn't need to cross the blood-brain barrier. Alright? Another mnemonic for this is what I learned from my board review. And the YL7, my previous students remember this pa. They were asked by a professor and then they were able to answer in unison. Because of this mnemonic. Yung chaga 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 ni 40 marks! Okay. I know it sounds corny but you won't forget it if you sing it. Okay? Adverse effects, most notable ones include hemolytic anemia, multiple CNS effects, and renal failure. Even if it doesn't cross the blood-brain barrier. So caution when you're giving this also for patients who have liver problems. Okay, last part. For other protozoal infections, I made this table to summarize everything else. For Balantidium coli, which can cause diarrhea, abdominal pain, and sometimes a perforated colon, the drug of choice is tetracycline, which you already know right now because you've had a lecture on antibiotics. Giardia lamblia, the drug of choice that causes traveler's diarrhea. Tas 'di ba sa microscope, remember yung old man, yung face. Okay? It causes diarrhea outbreaks also in daycare centers. The drug of choice is metronidazole or tinidazole, similar to our amebicides, diba? Or extraintestinal amebicides, or those that have moderate to severe amebiasis. Alternative drugs include furazolidone, which I couldn't find a lot of data about it in Katzung, so I researched na lang online. And albendazole and nitazoxanide. We'll talk about nitazoxanide and furazolidone later. Trichomonas vaginalis, metronidazole. Diba I told you kanina, tinidazole can be found with thioconazole in Gynomax. So, you can also give that. And for Cryptosporidium parvum, which is it's actually a diarrhea causing protozoa that protozoon that is usually found in immunocompromised patients. So it's if I remember correctly, I think it's one of the most common causes of diarrhea in HIV/AIDS patients. And the drug of choice is paramomycin, but from my board's review before, I remember that nitazoxanide is also considered a drug of choice. But according to Katsung, it's only an alternative drug. You only give it for 3 days. Okay, so what's nitazoxanide? It's good for Giardia lamblia and Cryptosporidium parvum as an alternative drug, but you can also give it for metronidazole resistant amoebiasis. It's an active metabolite. Its active metabolite, uh, tizoxanide, inhibits pyruvate peroxidine the oxidoreductase pathway, which is a pathway found in anaerobic bacteria. Adverse effects include the following. Okay, so caution when you are giving this again to hypertensive patients and patients with um, elevated kidney function tests and liver function tests. Furazolidone, it's a nitrofuran. It interferes with bacterial enzymes and disrupts DNA structure. Should be taken with food. And you tell the patient to avoid food and drinks with tyramine and tryptophan. So you enumerate alcoholic drinks, beer, even alcohol-free beer, cheese, and yogurt. Also for cholera, salmonella, and shigella. So this actually is a bactericidal antibiotic. And adverse effects include the following. Fetal would be agranulocytosis, hypertensive crisis, if with MAWIs, monoamine oxidase inhibitors. Right? I patterned this from Dr. Henry's lecture way back. Because I've been teaching this. This is actually my, I think, 4th year teaching this lecture. Alright. Thank you very much.